Poor Dolche, she came in and she's very, very lame, and she just doesn't know where that foot is. Can you see that? If I put her foot like that, she doesn't lift it up. So, what we say in the veterinary term is that leg's, well, it's like if your leg went to sleep, right? You wouldn't know where it was. Dolche. She's Italian. She's an Italian schnauzer. Not really, she's just a schnauzer. But, so she doesn't know where it is, so we can put it up like that, like it should be, and then she can stand on it, but if you put it like that, she doesn't know it's like that. So that's called conscious proprioception. In the veterinary jargon, we call it CP. So she doesn't have CP, she doesn't know where her back leg is, it's kind of asleep. What would cause that? That means the nerve somewhere from the spine down to that foot isn't working. And she was doing it a little bit with this foot too, but now, as you can tell, let me show you, this foot, let's put that on the foot up, let me hold her. This foot she definitely can feel. So, also, if it's a spinal thing, we want to make sure she can feel pain. So as I squeeze it, she reacts to it. So that means there is some nerve sensation to that foot, but there's not enough nerve sensation that she can move it to where she wants to. So we can see if we were to walk her on the floor, we're going to see how she does. So you can watch and you can see she walks pretty good on that other leg, and she's kind of moving the top part of that right leg, but she doesn't really, she can't put it up where it should be. Come here, sweetie. Come here, Dolce mia. Dolce mia. Did you belong to the Sopranos? Dolce mia. So when this happens, oftentimes, let's look at your spine, Dolce. Oftentimes, you can see there's this, here's the vertebrae, and here's a disc in between the vertebrae. And when the disc starts to lose its elasticity and gets compressed and bulges just like a bleb on a tube, then that bleb will push up against the spinal cord and cause numbness. In Dolce's case, if the bleb pushes up right on the spinal cord, then there's no pain. If it pushes on either side where the roots are, then there's pain. So Dolce isn't really feeling pain, but she can't feel where her foot is. So let's just say this is the right side, so this little bleb would be somewhere on the right side of the spinal cord, pushing and putting pressure on it so she can't feel it. Also, it could be a nerve problem in the nerve that goes down to the leg. So in most cases, we give them some time and some anti-inflammatories so that they can feel better. I often use an NSAID or a cortisone, and also some tramadol, which is a non-narcotic analgesic. And the combination of those things and time usually produce wonderful results. So we're hoping that Dolce will feel better a little bit and with the medication. Let's take a look at the x-rays. If you look at the x-ray, you can see, well, the white squares are the vertebrae, and the darker spaces in between are where the discs are. And those discs can be calcified, and you can see right there and the next one where there's whitish areas, and the disc can get calcified, loses elasticity, and push up into the spinal cord. And below, you can see where I'm pointing on an MRI that it's getting pushed into the spinal cord. So that's what happens when a disc protrudes. It will press on the spinal cord up above and cause numbness. And here's the spinal cord, and here's the normal disc, how round it is.
and then below is the spinal cord with the disc pushing up. And in Dolce's case, that pushing up will cause pressure on that side of the spinal cord and numbness in the leg down below. So that's what happens is as the spinal cord sends new roots and nerves down to the leg, if they get pushed on, they'll get numb.
About a week after she came in because of the leg that was not working right. It's kind of didn't have any conscious proprioception in it. She didn't know where it was, kind of like it was sleep, like we were talking about. And she's just more animated today. See, she's looking around, Dolche, Dolche, and she's happier. I know that's not scientific, but that's what I sometimes look for, just movements and happiness. And she can point the toes in the right direction, but when she walks, but she does drag it somewhat, but it's a little better. So like the floor, it's slippery, but but you can see most of the time she's got it out instead of knuckled, so that's a good thing. My main reason to talk about this too is to tell you that it does take time. Anytime the spinal cord is pinched by a disc, that does take time for the inflammation and the sensation to return, sometimes weeks to months. So we'll continue to hope that Dolce makes very good progress.
I always like to summarize, just make sure I got my point across. I was fumbling around with that skeleton, and I'm not sure you could really see the disc, but I hope you got that the vertebrae are square type structures, and in order to get flexibility, our body has elastic giving structures in between called discs, and when those discs lose their elasticity and get weaker, especially up top, they can form a bleb like a tube, and they can put pressure on the spinal cord or the nerves down to the leg, and they will get numb or painful. And sometimes it takes pain relievers to make an animal feel less pain, and that means that aspirin will work, or NSAIDs, or cortisone. If your dog gets painful at home, you can always try Benadryl at 1 milligram per pound and aspirin at 5 milligrams per pound twice a day, and that's always a good thing to have in your first aid kit, because aspirin and Benadryl and an ice pack can go a long ways for something that happened right away. And then if you have an swelling or pain that happens over a few days, then you can always hot pack the area, which will relieve pain more, help relieve the pain. Anyway, any spinal injuries or bad backs often last for the pain and swelling and the discomfort or lameness that you'll see in your dogs or cats will last for weeks to months, and that's usually we have to use pain relievers and anti-inflammatories when it comes up, and then sometimes they can recur and take some time to fade away with anti-inflammatories and pain relievers. Anyway, I hope that was instructional, and I hope you learned something from that. And check out Dog Dish Diet. In fact, I'll probably have a new book coming out in a couple of months called Dog Diet Answer Book, and it's an updated version of Dog Dish Diet. We'll have a lot of information about feeding your dog all kinds of different things. Anyway, have a good day.